May is Stroke Awareness Month, and Matthew Thoms is with us from Integris. We appreciate Matthew being with us today. As a physician assistant, kind of tell us what your role is and things that you're involved in, Matthew.
Sure. Well, I do exclusively cardiovascular medicine at the Integris Heart and Vascular Institute here in Enid. For the most part, I work with Dr. John Schrader, spend a little time with some of the other guys that are there as well, but mostly clinical medicine in the cardiovascular specialty.
Okay.
Yeah.
We're glad you're here. Thanks for being here today.
Absolutely.
Yeah, thank you so much for being here. As Steve mentioned, it is Stroke Awareness Month. So could you tell me what are the 5 signs of a stroke? The 5 main warning signs of a stroke.
Right.
If there's 5.
Yeah, if there's 5, or if there's more or less.
There are 5 or more than that, but a number of years ago, the American Stroke Association came up with the mnemonic FAST to kind of simplify that list a little bit. And I think it's preferable to the 5. The 5 can be difficult for folks to remember. And you know, really the cardinal sign that you're looking for in a stroke is asymmetry. So if you think of the mnemonic FAST, F stands for face. Is there asymmetry in the face? If you smile, does one side of the mouth go up and the other one is kind of holding still? Or if you try to squeeze your eyes together, is it just one eye that's you know, has the strength? If you go back again to the mnemonic, FAST, arms would be the A. If you try to hold your arms up, does one drop prematurely? Or are you able to make a tight fist with one hand but not the other? And then speech, that's the S. And that is difficult to really define, but are you having trouble speaking? Can you form your words? Are you able to think of the words that you need to put into the sentence and where they should be inserted? So any abnormalities of speech. And then the T is not really a sign, it's time. It's just to remind us that time is of the essence in a stroke event. You need to call 911.
Matthew, I've heard of the term mini stroke. Is there such thing as a mini stroke?
That is a great question. It's a phrase that most of us in medicine kind of wish would fade away. A mini stroke is what most people call a mini stroke is actually a TIA, or a transient ischemic attack. And the reason we don't really like the phrase mini stroke is that a TIA is not a stroke. It is a red flag saying you need to do something or you will have a stroke. So the difference being that in a stroke, you actually have damage to brain tissue, and in a TIA, or what someone might refer to as a mini stroke, it's a warning sign, but without damage to the brain tissue. You look for 24 hours as kind of the marker that all symptoms will have completely resolved within 24 hours. And if they do, then it's a TIA.
And if you see any of these symptoms in someone, or if you suspect a stroke in yourself, what should you do after you start to see these signs?
Right, so if you are at home or somewhere outside of a medical facility and you begin to see signs like that and you're suspicious, you know, the FAS sort of signs are showing themselves, honestly, the very first thing you want to do is just call 911, because in a stroke situation, time is everything. The longer that event goes on, the more brain tissue damage occurs. In rare situations, there could be a need for CPR, but that's unusual. Obviously, if they're not breathing, if they don't have a heartbeat, CPR would be appropriate. Aspirin is not typically recommended if you suspect a stroke. You know, in the case of a heart attack, people should chew up an aspirin, but in a stroke, it can actually do more damage than good, because there are different types of strokes. Some types of strokes are actually helped by aspirin, but others are made worse. And since you don't know when you're at home which kind of stroke you're having, avoid the aspirin. It is important to kind of take note of what time those symptoms started, because when you are in a healthcare facility, the time is important when it comes to what treatment is going to be administered.
Matthew, in preparation of our visit this morning, I saw the phrase silent stroke. Can you kind of share with us what that term is, or is that another term that needs to go away, or
not necessarily? It is surprising how often, you know, we find evidence of a silent stroke when we take imaging of someone's brain for maybe another reason entirely, and we go, well, you've had a stroke at some point, and they don't realize that. Now, sometimes that occurs just because the area of brain that is involved is so tiny that symptoms are, you know, almost just not there. Other times, people are just a little bit stubborn, and they'll, you know, kind of ignore those symptoms.
Invincible, maybe?
Yeah, absolutely.
So if they ignore those symptoms, is it possible for the stroke to go away on its own?
Technically, no, because again, think of those definitions. Stroke means brain tissue damage. That doesn't go away. So again, going back to the TIA, that is something that resolves spontaneously, but a stroke by definition could not just go away.
I think you've kind of touched on this a little bit. My next question is, can a stroke go unnoticed? I guess maybe a person could ignore the symptoms to some degree or whatever. They are invincible, or they are busy, or they say, oh, not me, or whatever. So is that a possibility? Have you basically encountered anyone that just kind of, it was just unnoticed to them?
Absolutely. Now, as a general rule, as I said, I find those when we image someone's brain for another reason, and then we see evidence of something that occurred sometime previous, and and sometimes they'll not even be aware that it happened. They'll say, well, I don't remember anything like that happening. Other times they'll recall, oh yeah, there was that time, you know.
With you just
it
saying,
happens.
When you just saying that, it reminded me of a time that my mother had passed out. She was living by herself, and she was cooking, and she woke up and found herself on the floor. And then months later, when we found out that she had had a mini stroke, if we can use that. But it was one of those things that she just thought she was tired and was, you know, passed out. But I guess that's one of those things that go unnoticed. So.
Yes, it can.
What are like the main causes of strokes? Like I've heard stress might be one of them. I don't know if that's true or not, but what are the main causes?
Because Aaron's in the engineering department, you know, with
stress.
Yes. And it's my
concern.
Finals week this week, so.
So when we talk about strokes come in basically two forms. A blood clot that occludes a blood vessel in the brain, and so everything downstream is then starved of oxygen and nutrition, or a rupture in one of those blood vessels. And the same result. If the blood is leaking out through a ruptured blood vessel, then everything downstream is starved. So we're talking about something that physically interrupts blood flow to tissue downstream. Stress being something that cannot physically block blood flow to a vessel is not a cause of a stroke. Not to say that it can't be a contributor in certain ways, but certainly wouldn't be a direct cause.
You've already mentioned to us that when you do a test of the brain, or I guess photos of the brain or whatever, you can determine if there's been a stroke or not.
Yes.
So this may not be a valid question about, can a blood test, can that give you any hints that there had been a stroke or anything?
A blood test really cannot diagnose stroke. Now, blood tests are an extremely important part of evaluating stroke, because they can certainly help determine what might have caused a person's stroke. And not everything that looks like a stroke is necessarily a stroke, and so a blood test can be also helpful when we're trying to look for other things that can mimic a stroke. So, you know, if you show up in an emergency department with signs and symptoms of a stroke, blood work is going to be an important part of that evaluation, but there's not really a blood test that will show stroke.
My next question is probably really broad, but what is the best treatment for a stroke? It probably depends patient to patient, doesn't it?
It very much depends. That's exactly right. And, you know, I mentioned a moment ago that strokes really come in two varieties, whether it's blockage by a blood clot that prevents the blood flow or a ruptured blood vessel. Determining which of those two types of strokes is going to be the first step in treating, because they're treated very differently. And then there's a lot of other factors in there. You know, have they had surgery? Have they had strokes previously? What's their blood pressure? So really, when you talk about the appropriate treatment of a stroke, that all begins with finding answers to those questions and then sort of outlining the best treatment line. Yeah.
Matthew, we have one more question before we move on to another part of our show. Who is most risk for stroke?
Age does play a role. The older you get, the more likely you are to have a stroke. Smoking is a major factor in smoking. 1 pack of cigarettes per day increases your risk of stroke 6-fold. So that's a significant risk factor. Uncontrolled hypertension, certain heart rhythm issues like atrial fibrillation, especially in those who don't take blood thinners and antiplatelet drugs like are prescribed, and folks that have had a stroke in the past. You know, all of those are big risk factors.
Okay.